Hello, and welcome to our video on the revised Pediatric Blood Pressure Management Guidelines and the Electronic Health Record clinical content changes. In August of 2017, new national guidelines were disseminated for evaluating pediatric blood pressure. These changes are described in detail in the following link. Several of the major guideline changes will be reflected in the EHR-based Pediatric Blood Pressure Interpretation tool. In the first portion of this video, we will give an overview of the guideline changes. In the second portion, we will review EHR-specific images to guide you through your workflow. Now let's get started with the guidelines. Change number 1. Blood pressure percentiles driving the classifications presented in the EHR are from tables 4 and 5 in the reference 2017 guidelines. New normative values for BP were driven from normal weight children rather than the general population. The end result is that the cutoff values for abnormal BP are lower. Change number 2, nomenclature changes. The term prehypertension will now universally be replaced with elevated blood pressure. Change number 3. If a patient's initial blood pressure is elevated, meaning greater than or equal to the 90th percentile, 2 additional blood pressure measurements, either automated or manual, should be obtained at the same visit and averaged. The averaged measurement is used to determine the child's blood pressure classification. Change number 4. For children who are 13 years of age or older, adult blood pressure cutoff values for classifications will apply based on the 2017 American Heart Association guidelines. Now let's get started with the EHR portion of the video. The Pediatric Blood Pressure Interpretation tool was designed for patients 12 months of age and older. This patient is a 7-year-old patient. We can access the PEDS BP interpretation tool from the Vital Signs page as follows. Here we see the ranges of the percentiles of the patient's systolic and diastolic blood pressures. In addition, we see the blood pressure classifications. This patient is classified as having stage 1 hypertension. Because the patient's blood pressure is greater than the 90th percentile, we are given a recommendation to reassess the blood pressure. So now we've entered in reassessed blood pressures. We've entered in follow-up values for this patient that were obtained automatically. We are now going to select these 2 blood pressures and calculate the average. With the calculated average, we see that the patient's blood pressure calculation is still above the 90th percentile. We are then given guidance to obtain a manual blood pressure. We will go back to our screen. We are now ready to enter in some new manual blood pressure values. We're now going to select these values and calculate an average. As we can see, our reassessed values are still elevated, but because we have completed our reassessment, we will make this our primary blood pressure. Here at the left lower corner, you can see a reference table for the classifications based on the new guidelines. Finally, let's review the previous blood pressure results tab. The intention of this tab is to not only present today's blood pressure, but to also present historical blood pressure values. By showing historical blood pressure values, we're able to determine if the past systolic and diastolic blood pressures have been within normal range or if they have been elevated. By doing so, we're able to indicate to the provider how many abnormal blood pressures the patient has had historically. And lastly, let's see how all of our documentation has been captured in our note. Through our text translation, we're able to see what our initial blood pressure value was and also our multiple reassessments. And this concludes our blood pressure interpretation tool, EHR Demo. Thank you for your attention, and we hope you found this video helpful to guide future use of the blood pressure interpretation tool.